to Chamber Chat. I'm Stephanie Ford. This week we are chatting with Advent Health Daytona Beach, Dr. Heimberger. Welcome.
Thank you. Thanks for having me.
Tell us a little bit about you and your specialty.
Yes, so I am a colorectal surgeon. I just moved to the area and I treat the whole spectrum of colorectal diseases, including colon, rectal, and anal cancer, as well as other benign diseases such as diverticulitis, ulcerative colitis, and Crohn's disease, and all the other diseases that, for lack of a better term, are a pain in the butt, such as hemorrhoids, abscesses, fistulas, things like that. So I take care of the whole spectrum of colorectal surgery.
And tell us a little bit about you and your background and how you got here.
Yeah, so I was actually originally born and raised in Mexico. My parents were missionaries for approximately 40 years.
Wow.
I moved here to Florida when I was 15 to play tennis, subsequently transitioned into medicine. I did my general surgery training just up the road in Jacksonville. And then while I was there, I discovered my passion for colorectal surgery. Colon cancer and rectal cancer are very curable if caught early, and they are treatable with an operation, and that's what really drew me to colorectal surgery. So then I went to Stony Brook in New York for fellowship, and then now I'm back down in Florida where I love to be.
Great, and you're relatively new back in the Daytona Beach area. Tell us a little bit more about how you would, some of those procedures that you do for colorectal and how you would, some of the options that people have.
Yeah, so I specialized in minimally invasive and robotic surgery. So instead of having a big open incision like it was back in the day, we now can do operations through small little incisions. I specialize in that to take care of both cancers and benign diseases.
And is that relatively new? Some of the new technology in medicine is now going more with the robot technology, and how is that a benefit?
Yeah, so laparoscopic surgery has been around for a couple decades. It has subsequently transitioned to robotic surgery. That's been around at least for my whole training, so I was able to have my general and colorectal training with robotics. It is very helpful for patients. It minimizes their length of stay, minimizes complications. Patients have quicker return of bowel function. They have less pain postoperatively. They are able to leave the hospital sooner. And their outcomes are just as good, if not better.
So it's the future of surgery. So tell us a little bit about colorectal disease. What are some signs or symptoms, or what are some things that, why would be a reason or a cause for concern to reach out?
Yeah, so a lot of times the onset of colon cancer is asymptomatic, so no symptoms at all. But very important, if you're having changes in bowel habits like diarrhea or constipation that you didn't have before, or if you see any blood in your stool, it's very important to get checked out. If you have any abdominal pain that's abnormal or something that's not your usual, you should definitely reach out to your primary care provider.
And what about screenings? I hear that has become quite important, and when to get them.
Yes, it's very important to get your colon cancer screening. The overall incidence of colon cancer is going down, but we're seeing an increase in cancers in younger patients. Approximately 10% of colon cancers are diagnosed in patients under the age of 50 now.
Wow.
And because of that, we've rolled back our screening recommendations to age 45 as opposed to age 50. That is for average risk patients, so that means no family history of colon cancer, no history of inflammatory bowel disease, things like that. If you're average risk, you should get your colonoscopy at 45. If you have any family history or any other risk factors, then you should get your colon cancer screening earlier. And again, if you have any symptoms, bleeding, changes in bowel habits, get your colonoscopy.
I hear that that's just a nice nap. It's just a great opportunity to go into a deep sleep for a little while. I'm years away from that. The average age is 45? Yeah, a while to go. He laughed too hard. Anyway, tell us a little bit, what would be your 3 tips though for maybe prevention, or how can you, prevent this type of cancer?
Yeah, so we know colon cancer is both genetic and environmental risk factors. So what we can do is change our environmental risk factors and our lifestyle factors. So the most important things are living an active lifestyle, exercising every day. We know that obesity is associated with higher risks of cancer in general, and colorectal cancer is included with that. Avoiding smoking and drinking. Obviously, those are known to be causes of cancer. And then specifically for colon cancer, we know that increased diet in red meats is associated with colon cancer, and low fiber diets are associated with colon cancer. So try to limit your intake of red meats and increase your fiber intake. Those are things that you can do on a regular basis.
So just once again, the answer is exercise, eat healthy, enjoy an active lifestyle. That kind of seems to be the key to life. Speaking of, do you have a philosophy that you live by in your practice?
Not necessarily just my practice, but overall in life. There's a quote by Gandhi that says, "Live simply so that others may simply live." I learned that a long time ago, and I try to live by that.
That's great. And you mentioned you're a tennis player. You still playing tennis?
I do. I took a little hiatus during medical school training and all those things, but I am playing again. I moved initially to Florida to play tennis, and now I'm back in Central Florida. I play tennis here locally, actually at a place that I used to play junior tournaments. So it's nice to do that.
That's great. I too was a tennis player, but I don't think I'll be taking you on anytime soon. I'm probably bound for pickleball myself. So anything else any other words of wisdom you want to leave with us, or how can folks reach out and get in touch?
Yeah, so I really want to stress to everybody, don't take symptoms lightly or for granted. I like to say nobody should die from embarrassment. Colorectal issues are sometimes a cause for embarrassment. People don't want to talk about them. But if you're having changes in bowel habits, if you're having any blood in your stool or any changes, talk to your primary care provider, get your colonoscopy screening. It's very important because colon cancer is very curable, very
preventable.
preventable.
That is some good news.
Yep.
Well, we've got some info on the screen how to get in touch with Advent Health. Dr. Heimberger, thank you so much for being here. Great information. And as always, a special thank you to Shark City Media for producing this content.